Bismillah ar-Rahman ar-Rahim, Alhamdulillah Rabbil Alameen, wassalatu wassalamu ala Sayyidina Muhammad, wa ala alihi wa sahbihi ajma'in. Again, assalamu alaikum, everyone. May peace be upon you. I am Edward Ahmed Mitchell, the Deputy Director of CARE National. Hope everyone is doing well. I'm here tonight with my wonderful co-host, Zainab Chowdhury, who is the Director of our Maryland Outreach Office, and also by training a pharmacist. Zainab, how are you doing?
Assalamu alaikum. I'm hanging in there, alhamdulillah. How are you doing, Brother Edward?
Alhamdulillah, I'm doing well. As you know, Zainab, I'm coming to you from Atlanta. We are still sheltering in place down here, like the vast majority of Americans around the country. What's the latest in Maryland, Zainab? Any good news? Any distressing news? I mean, what's the latest that people may need to know from the state of Maryland?
Unfortunately, not a whole lot of positive news at this point. That we're still in a state of lockdown. Our governor is actually working to close public parks and recreation facilities because folks are unfortunately still going out into the community and defying the rules of social distancing. But overall, I think the majority of people are abiding by the rules and they understand the importance and the gravity of why it's important to abide by these rules of social distancing to just kind of make sure that we're able to get the numbers of infections under control and to just try to move our state forward in a positive direction.
Absolutely. So, we always like to begin the program by just sharing with you all some general news updates about the state of the coronavirus. As you all may have seen, it looks like social distancing is working. We're still seeing, a horrific and disturbing death rate, infection rate, but in several places, it's starting to level off a bit. New York has seen their numbers of daily deaths reported start to level off. We've seen that also a bit in other New England states, which is hopefully a positive thing. It doesn't mean that it's over, that we're out of the woods, but it does indicate that what we're doing is working, and inshallah, God willing, is saving lives. Is that the case as well in Maryland, Zainab? Any stats we have there showing a plateau?
I would say that right now the numbers are still climbing, but the good news, if there is any good news, is the fact that we're not where we had anticipated we would be in terms of the number of cases. And so even though emergency rooms are getting full and the ICUs are getting fuller, we're not at the place right now where we've had to use tertiary facilities that have been set up by the National Guard, for example, in Baltimore and states or places around the state. So that's definitely something to celebrate. But I think the point that you made, Brother Edward, about even though the fact that social distancing seems to be working, that we can't feel comfortable enough to begin, getting sloppy and going out into the community because there's still a long way to go. And until we actually get numbers that show that the number of infections are decreasing and we're in a place where it's safe to go out, I think it's still really important, the point you made, to abide by those rules.
Yeah, absolutely. And I mean, it's really stunning if you look at the numbers. We got 478,000 people tested for the disease in New York, 196,000 tested in Florida, 190,000 tested in California. Those are just the numbers of tests. In the United States total, we apparently have 682,000 confirmed cases total. That's the most confirmed cases in the world. So even when we're saying there's some positive news, it's still just remarkable how many people this has impacted. So we definitely don't want to get too happy too early and mess up the progress we've made. So may Allah guide us to get through this safely and securely. Zainab, as you know, part of the unique and horrifying things about this illness is the impact it's had on minority groups, African Americans and others, disproportionate to the number of African Americans and minorities who live in the country. And so tonight's program is really about COVID-19 and its impact on minority groups. Why is it impacting minority groups in such a harsh way? What are the historical explanations for this? What are the modern explanations for this? And we're so excited to have a very special guest with us to discuss these issues. Zainab, do you want to take the honor of introducing our special guest?
Absolutely. I'm delighted to introduce Sister Donna Neil-Demir. Sister Donna, are you here with us? Can you hear us?
There she is.
Sister Donna, assalamu alaikum. How are you doing?
Thank you for having me.
It's wonderful to have you here with us. Thank you for taking the time out of your very busy schedule to join us on tonight's episode. I'm going to begin by just giving a brief introduction, and I'll let Brother Edward take it from there with the first kind of question that we want to segue into. So obviously, Sister Donna, your resume is very impressive, mashallah. You've been a longtime community advocate. You've been doing a lot of work especially in the Chicago community. You come to us as a health advisor for the Zakat Foundation of America, which is a Chicago-based Muslim-run NGO that focuses predominantly on serving the disadvantaged and disenfranchised communities, not only across the country, but I believe internationally, correct? Like
Yeah.
globally.
Yeah.
And you also work as a registered nurse at, is it Little Company of Mary Hospital? Is that right?
Yes, well, let me correct that. That was the last hospital position that I did have. Okay.
Wonderful.
One of the three. One of the
Wonderful, wonderful. And I've been following a little bit of your work that you've been doing to specifically provide PPE, protective gear to healthcare workers who are on the front lines, and gloves and face masks and things like that. And I want to tell you, just on a personal note, how much I appreciate the humanitarian work that you've been doing, especially in this moment. I have family and loved ones who are on the front lines serving to help protect patients and help heal patients who are sick. And the shortage in PPE has really been something that I think has exposed the deficiencies within our public health care system. So thank you for all that you've been doing to provide support.
Our pleasure. Our pleasure.
Yeah.
Thank you so much.
Yeah. Thank you so much, Donna, for joining us. I should say my mother's first name is Donna, so automatically, you and I have a bit of a connection. I love, Donna. So thank you so much for joining us and for the work Zakat Foundation is doing and the work you've done as a nurse personally. So, we were speaking a bit before the program started, and we were discussing, do we want to start talking about COVID-19 right off, or do we want to talk about history and how we kind of got here? And I think you and I agree, we want to talk a bit about history and how history could explain to some extent why minority groups and African Americans, are being impacted by this perhaps unduly compared to others. Can we start, Donna, by talking about, your historical research into this subject, the book that you wrote about this subject, historically, what kind of experiences have African Americans had in the medical system in the United States? And how are those relevant to the present day?
Well, our circumstance as African Americans in this country, without making it too long and drawn out, it's really impossible to understand today if we don't understand yesterday, and everything that happened before that. A lot of times we get caught up in it, and we hear things like, "Oh, well, that was then, this is now." We carry a lot of things in us. We carry the trauma, just as we know PTSD survives, and it's handed down from generation to generation. Unfortunately, it is a passed down, unwelcomed gift. That is and that has pretty much always been our situation as African Americans in America, if you want to call us displaced Africans or whatever terms chooses to use. In regards to the healthcare system, it's always been very separate, just as our lives. And Chicago is probably one of the most segregated northern cities. Anybody who's read back a little bit, and I will lead into the medical component, but anyone who's ever read back a little bit, anything that Dr. King has ever written when he was here in Chicago and in Marquette Park, that was the place that he was actually stoned. And he said himself that he had never felt the kind of hatred anywhere else that he felt after marching through Selma, Alabama, through Mississippi, all of these places deep, deep, deep in the South. So we still lead a very, very segregated life in Chicago. That's one thing I think that's very hard for a lot of people to understand, but we do. We really, really do. And unfortunately, that's infiltrated too, by the way, with our own community, within the Muslim community to a certain extent. So when we talk about how we've been extremely segregated and how that plays into the healthcare field, there were hospitals that Blacks were not to go to. We still have, by the way, cemeteries here that are predominantly Black cemeteries. There were only 2 Black cemeteries, and where Emmett Till is buried is about 20 minutes from where I live. So we fast forward to healthcare.
Let me ask you, Donna, so because people may not know, I mean, we're kind of assuming that people in the community, the Muslim community and otherwise, know how this virus is impacting African Americans and others disproportionately. Can you maybe maybe just briefly explain to us what is happening to the African American community compared to other communities with this virus, and then connect it to what we're talking about.
Fair enough. Fair enough. If you look at some stats right now, what's going on, African Americans are 7 times more likely to contract COVID-19. That falls into a lot of different reasons and categories. Of course, poverty is always an issue. Housing is an issue. Unfair housing is an issue. Crowded housing is an issue. There's no ability, no way to really distance yourself. That social distancing of 6 feet, that does not apply in minority communities. We just had a hospital here in Chicago close, a small community hospital that's been around for at least 60 years. It just closed down because the ER was too small.
Hmm.
So what happens to those people? It's just horrific. We were already living on the edge, and now this just brings everything up to the surface. Pot was already boiling. Now the pot is boiling over. When we talk about why we're not able to socially distance, why we can't stay home, because we do a lot of service jobs. Only 20% of the African American population can actually stay home and work because we don't have those kind of jobs. Let's talk about education, educational systems. People don't have cell phones. People can't afford cell phones. Kids don't have a computer. Kids don't have a laptop. You know, our schools, you want to talk about the Chicago public school system and schools across the country, how the disparity even in education. We don't have music programs. We don't have art programs in a lot of our schools. We still have programs that were implemented, surprisingly enough, most people don't know this, but the food programs, the breakfast programs, those were initially started actually by the Black Panther Party. People don't know that. You know, in San Francisco, we still have kids that are hungry, that go to school every day in the inner cities across this country. And Chicago is a very fine example. And so when you say that people of color are 7 times more likely to contract this disease, I mean, just think of that for a second. We're supposed to be in Chicago, we're 30% of the population, African Americans are. But when you look at the deaths, 70% of those deaths are African American community. So just think about that 1 second. We're 30% of the population, but 70% of the deaths are African American. Why? Why? Well, we can go back into this also, the simple fact that it didn't start off equal. It really never started off equal. In our neighborhoods, we live with food deserts. So that brings us into a medical component of who's at risk, who's at high risk. Okay, those people that have certain pre-existing conditions. Oftentimes we say, and you see this a lot too, I have to add this in the Latino community, you see this a lot too, diabetes and hypertension is very common, correct? But can we really say which came first, the chicken or the egg? Really? Because, you know, diabetes, if you eat poorly, that plays a part. If you eat poorly, you can become hypertensive. So there is a pre-genetic disposition to these things. Also, living in a food desert doesn't help. Living with great stress doesn't help. We can talk about violence. We can talk about food. We can talk about just poverty. We can talk about the isolation. We can talk about single family homes. We can talk about people stacked on top of each other. All of these things play a big role in the disease process, the health status of a person, their mental health, depression, anxiety, all of it, you know, so you really can't look at one without looking at the other. There's just no way.
You know, Sister Donna, the point that you made earlier, this is all such pertinent, such relevant information. The point that you made earlier about the working from home piece and how so many of our community members and specifically members of the African American communities who are on the front lines providing vital services, and they don't have that luxury of being able to work from home. One of the questions a community member asked me was what specifically can be done to make sure that those workers are able to get the protection that they need. If they're not able to get it from government, do you, in your role as a nurse, specifically as an expert on this topic, do you have suggestions on ways that we can provide support to those who are on the front lines, who are providing critical services right now, whether they are working in grocery stores, whether they are delivering food to people's homes, whether they are working in different capacities? How can we support them?
Well, that's a good question, Sister Zainab. And right now we're working. We're in a state of emergency. We're in a state of emergency as a nation, as a country, at the globe. We're in a state of emergency. However, in the African American community and in the communities where minorities reside, where refugees reside, we are in an extreme heightened state of emergency because we're already starting off, with a great disadvantage. So we have to act right now on what we can do right now. Okay, there's other things that we can do later that just hasn't happened. Right now, our only option is PPE, personal protective equipment. That's the only option. People have to work. People have to go to work. I personally have friends, even before COVID came, they could not afford to be sick. They're not allowed to be sick. I don't know if anybody out there has ever known anyone who's not allowed to be sick. I mean, just think of that for a second. How are you not allowed to be sick? It doesn't matter. You have to go to work. It doesn't matter if you die. I just had a childhood friend say, if I catch it and I die, I have to go to work.
That's devastating. Yeah.
It's unbelievable. It's unbelievable. Really, so when we think about this, like the answer to your question right now is we have to try to provide personal protective equipment, which, as you've said, on behalf of Zakat Foundation, I have been out there taking these things to hospitals myself, taking gloves and masks myself to the hospital, just me in my car driving, taking thousands and thousands and thousands of gloves, delivering them all over the city, masks when I could get my hands on them. Okay.
When we talk about in healthcare, for example, like the disparities that exist, specifically racial disparities, I remember being born and raised in Baltimore, growing up in the inner city, that a lot of times people who don't live within that area or who don't have experience firsthand, they have some level of like a level of tone deafness. Like they don't understand like the urgency of this situation. There are some people who argue that racism is actually the biggest risk factor that predisposes communities of color, specifically African American communities, to COVID-19. What is your response to that? Instead of race, what is your response to that, to racism being the biggest risk factor?
Well,
and can I, Donna, before you start, can I note, as we all know, I've got to step away at this point from Margaret, but I also would love to hear, and I think the audience would love to hear, following up on Zainab's question, what can our policymakers do about that? If the answer to that question is yes, it is, what in the world should the government be doing about this issue? Because it's a long-lasting issue. What can they do? What should they be doing that they're not doing? If the answer is yes.
Yes. Well, that was going to be the second part to my question. To my answer, actually, the initial part, what we do right now is we have to keep people. We have to be useful in keeping people as safe as we possibly can. And right now, that's going to be with personal protective equipment. Okay, we don't have any other options. People go to work. They're not going to take a stroll by a lake. They have to go to work. Okay, some of these people are helping us, the ones that work in grocery stores, the ones that do pick up our trash, the ones that cut our lawns, these kind of things. That has to be done. PPE is the answer for that. Government has not come through with those things the way that all of us thought they would in every state, not just Illinois. Okay, the other thing, when we think long term, some of these things are just going to have to be worked at. Then the question comes up, well, whose job is that? Whose job is that? Yes, when we look at our Constitution, our government owes us that much, but we owe ourselves. There's a few things we have to do as well. We have to vote. We have to know who we're voting for. We have to appeal to our senators, our state legislators. If we have to picket, if whatever we have to do to just get fair treatment. The problem is that we've just kind of just accepted it as the status quo, and now here it's back again. 400 years. We're 400 years out of slavery.
And speaking on that point, there was a huge movement to call for reparations, not only in Maryland, but in cities across the country, states across the country. Sister Donna, I wanted to touch on this with you. In her book, Medical Apartheid, you might have heard of this. This is a book that was written, a critically acclaimed book that was written by author Harriet Johnson. And it traces the disturbing history of medical experimentation, specifically in Black communities in America, since the 1700s, since the early 18th century. And she makes the compelling argument. She talks about the fact that diverse forms of racial discrimination have shaped both the relationship between white physicians and Black patients, and also the attitude of Black patients with their healthcare providers and the medical system in general.
This is so big. It's become it's in our DNA at this point, and it really, really is. Let me cite some more recent circumstances. People might and those who love to read might know these things, might not. Let's talk about the Tuskegee Experiments that just stopped in 1972. Those went on from 1932. Those went on for an extremely long time. You know, they just stopped in 1972, where African Americans in Tuskegee were injected with syphilis, and they followed them. You can just open up, just Google it. You'll find it anywhere. This is very well known, very, very well known. It just ended in 1972. They followed to see how syphilis reacted in the body. Okay, it was spread all around to just regular people. You know, that was the more recent one. This one, it was a movie that came out about it, and I don't know how many people caught it. I don't think it was out very long. It was a movie about a woman named Henrietta Lacks, an African-American woman born in in the 1920s. She died in 1951. I'm sorry, she might have been born a little bit before that. She died in 1951. She had cervical cancer. And this will tell you exactly why the African American community has very little trust in the medical arena. She, cervical cancer, they actually removed her tumor, and then they took the cells unwittingly, unknowingly, and they still use those cells today because they found out that her body responded differently to treatment. They're called HeLa cells, HeLa, HeLa cells. Her family never got anything for that. No, nothing.
And when it's outrageous. I mean, and when we study this history and we understand the impact that this has had on a community, when people talk about the fact that social distancing is such a big thing now, and they talk about how specific communities are not abiding by these guidelines, what is your response to that? And what message do you have as it pertains to social distancing within that context, understanding the fact that there's this long legacy of disenfranchisement of an entire people? Like, how do we connect those dots and get that message across?
Well, this has a lot to do when we talk about social distancing. See, in these communities, we're talking, then that comes into housing and housing discrimination. You have an apartment, or you have a house where you have 3 generations living in because of poverty. How are people going to be able to social distance? And then these people have to go to work. They have to go to work. They can't afford to be sick. So you have a lot of people piled on top of people. Now, those are circumstances. You have people who live in apartments, family that live in apartments. Everyone's familiar with the projects that we had torn down in the 80s here. People were living stacked on top of people, and people still live that way, you know? So social distancing is impossible, even if people would want to do social distancing. Now, if we want to talk about education, have people been educated? Are people aware of what that means? Do people have even the understanding of what social distancing means and why? We're still battling, just as you said earlier, we're still battling a lot of people who don't even believe that this is a real disease. That's another entity of it. But when people are forced to live under conditions where they don't have food, they have liquor stores. They have liquor stores on every other corner, okay, where the best thing that they can hope to get is some hot chips, maybe. You know, how nutritional is that? You know,
and those food deserts that we see within especially within urban areas, these food deserts are such a huge factor that play a big role in the fact that many communities are not able to abide by these guidelines. I mean, you've got to put food on the table, you've got to feed your kids, you've got to be able to buy basic necessities. And how do you do that when you don't have access to that? Sister Donna, one of the other questions I wanted to ask you, I wanted to segue into your expertise as a public health expert. And obviously you've been doing a lot of wonderful work with Zakat Foundation and through your humanitarian work in Chicago, and that's had impact even beyond the city. What can you tell us specifically about race and disparities within the impact, in terms of the impact on African American communities, and as it pertains to your experience here in the United States versus maybe some of the work that Zakat Foundation has been doing in Mali and in other parts of the country?
Well,
what kind of differences do you see between here and there?
Well, let me say a little bit about Zakat Foundation on that. Zakat Foundation, we were established 2 months before September 11th, actually. So 2001, a very difficult time to start a foundation. And we work in 40 plus countries. Right now, we have a COVID response for 10 countries outside of the US. Immediately here in the US on our projects when the first shut-in was implemented. But prior to that, we were already doing food packages in the impoverished areas here in Chicago, where our corporate office is, okay? So this is, because we're involved in emergency preparedness, this is something that we do domestically and locally, okay? Mm-hmm. Let me just put that out there. Now, I can't really draw on a lot of similarities because Africa is a very different condition. I can say that education is an issue, just like it is here. I can say unemployment is an issue, just like it is here. I can say food is an issue, just like it is here. Sanitation is an issue there, just like it is here. I even wanted to tell you that personal protective equipment is not an issue here, but it is an issue here. The only difference between Africa and here is that it is completely non-existent, completely non-existent. The concept of a mask is unheard of. What they're battling with now, because I'm on the phone with Mali and Kenya specifically, every other day, they're struggling to get people to understand that face masks are not two-sided. The blue side goes out, the white side goes in, right? They have to deal with a much worse literacy rate than we do. That's true. That's true. It's just a different degree of poverty.
So we're so grateful to the work that Zakat Foundation is doing, and we're proud to support these kind of efforts to raise awareness, to support the communities that are most in need of our support across the country and around the world. So may Allah subhanahu wa ta'ala bless the Zakat Foundation and bless you for the work that you're doing in your capacity as a health advisor for Zakat Foundation, because I think the role that you play, it's so critical to help kind of identify what specifically needs to be done in terms of educating the Muslim community and the broader community of what the reality is on the ground. I wanted to also touch base with you, Sister Donna, that when we talk about international inequality and need, what are kind of the key takeaway points that you would like to communicate with our viewers tonight about the crisis, the racial disparity, specifically about the pandemic that we're experiencing? What do you feel like are the key takeaways? There are some who say that we are in the midst of this global crisis, and it's upended our world, it's changed things as we know it. We're in a situation where we are forced to confront a reality that many of us have never anticipated we would have to confront. But at the same time, this reality is exposing the racial disparities that are existing within our society. Over the course of the last week, we've been having a national conversation about the fact that the most populous cities in our country have a crisis where those communities that are the most disadvantaged, most disenfranchised communities in the country are not able to access basic healthcare and basic needs that they have to have positive outcomes. What is the key kind of takeaway point that you would like to leave with our viewers with?
I just want to say, if ever, this is a time to understand that what affects one person affects everybody. What affects your brother affects you. If we don't seem to understand that just about this virus alone, I mean, how much more apparent is it? If someone on the other side of town, we can deny that about bullets. We can deny that about gangs. but we cannot deny that about this COVID. If
That's
someone has,
powerful.
oh, extremely,
Yeah.
extremely. If your garbage man comes and he has it, if the Latino person comes and they happen to do landscaping and they have it, okay, maybe you don't have to live with them, but they have it and it's coming.
Yeah.
You know, I can't emphasize that one enough. We are all here and we all have a purpose and we all have a responsibility. No matter what you believe, no matter how you pray, we all have a responsibility. And I want to say with that too, I did not have a chance to address some practical stuff quickly. I'm going to say I wanted to talk about these masks as a healthcare provider. And I'm going to say, first of all, we need to stay home. Everyone needs to stay home. Okay. Wash your hands. Don't go out without a mask. There is a very strong theory that this disease process is airborne. Okay, there are a lot of people who are positive carriers that have absolutely no symptoms. We see it in the emergency room time and time again, where people come in for a dislocated shoulder, they get a chest x-ray and they're full of COVID. They've had no symptoms. This is airborne. Nobody should be going out, period. And then nobody should be going out without a mask if they have to go out. That's one thing I have to say for everybody's sake. It's very, very serious. You need a mask. The other thing I want to say is that at Zakat Foundation, we've had a long-standing relationship of doing social justice against any disparities, against any situation where people are not being treated fairly because of their religion, race, or ethnicity. Okay, and we will continue to do that work because we serve humanity. That's why we were founded. It's part of our mission statements. It's part of our faith that we should move forward in this way. We take it very, very seriously. And last thing is, we actually have a memorial wall that was launched. If you go to www.zakat.org or info@zakat, you can do one of two things. You can help us. You can make a donation. $50 feeds a family of four for a month. Okay, for a month. If you've lost someone, no matter who you are listening to this, we hold no discrimination against anybody. Okay, if you've lost someone, you can go there and post your loved one's picture. You can post your story. We just launched that actually 2 hours ago. It's a memorial wall because you know why? Because we might be different. I can't feel your pain, sister. I can't feel your pain, brother. I can't feel it. But you know what? Our hearts know grief. My heart knows grief. I have experienced it at one time or another in my life, and we all have. So if anybody wants to go there and they want to post something about their loved one, we encourage you to do that.
What is that website
the
again?
browser again, where they go?
www.
Yeah, it should be in there. Okay, that's our COVID information. If you go there, that's the Launch Good page. But if you there's a memorial wall, and anybody can go. Anybody can go. This is very, very healing.
That's a beautiful gesture.
When we talk about mental health, I could easily talk another 2 hours if you let me. When we talk about mental health, this is so necessary. We're all going through this, you know, and believe it or not, we're going through it together. It might not be my family, but if I hear about you guys' family, it's going to hurt me because it could be mine, you know. Only by the grace of God, it was not mine. So my obligation is to pray for you, you know, and that's our obligation towards one another. Maybe this has something to do with it. Maybe it's all about love. Who knows? You know,
that point that you made earlier, Sister Donna, about the fact that we are all connected, the fact that this impacts all of us, regardless of our socioeconomic status, our race, our religion, and how, you know, irrespective of what our life experiences are, the people who we encounter in our daily lives are people who we have that bond with, regardless of whether we know anything about them or not. And what they do affects us, and what we do affects them as well. And I think that's just such a powerful point that you made earlier. Jazakallah for sharing that.
Yeah. So Donna, you know, it's we're almost out of time, but I know what you're sharing is so important to so many members of our community. Is there any parting advice you want to leave us with, especially you know, people of color who may, you know, feel that they have no choice but to be out there on the front line, still going to work because of the job. that they have, who may be in an environment where they can't socially distance. What advice do you have, that you want to leave us with that, people can take to protect themselves as best they can?
I'm going to say that the Zakat Foundation is part of the Black Muslim COVID Coalition, which was actually founded to address this issue specifically because we saw it coming within the African American community. Okay, the issue of isolation, the issue of loneliness. There's a tale of an 80-year-old woman, and you guys have to hear this. If you have to extend this for a moment, please do.
Yes, no problem.
Yeah, we have time.
80-year-old woman I heard tale of here in Chicago who made her way to the hospital 25 times. 80-year-old African-American woman, 25 times. Every time she comes in with another problem. This is wrong, that's wrong, this is wrong, that's wrong. Nothing was wrong with her. There was nothing wrong with her. You know why she kept coming? Because she didn't want to be alone. An 80-year-old woman, 25 times, probably on the bus, sister, probably on a bus. Do you think she's taking an Uber? Huh? This is just, it is ridiculous. It's so humane that people should have to live like this, and I just feel a great sense of responsibility. When I live on one side of town and I go on another side of town, even if I talk about being inside of a masajid or a church, and one is filthy and one is clean. Why? Why? We have to ask ourselves this, and this is way beyond healthcare. This is, there's not an area or a moment that this doesn't touch, or a person that it doesn't touch. The parable, what is it, you guys? If a tree falls in the forest, I might not hear it, but the tree still falls. Okay, absolutely. So I will leave you with that. Just know and trust that Zakat Foundation, we're there on the forefront. We will do whatever we have to do. I go out, I take the stuff. I go out, I come home, I wash all my clothes. I pray my family is healthy when I get home. I have a daughter, a 33-year-old daughter who's an emergency trauma room nurse in Dallas. And she's doing one-on-one patient care with COVID patients. And she asked me, she said, Mom, I think if they ask me to go to the other side, I'm gonna quit. I said, you what to do. My mother's side wanted to tell her to run, okay? My nursing side, my heart said to me, I can't tell her that. I can't tell her that, so we all have to bear some burden of the responsibility of this, of what happens within the African American community, what happens in the Native American community, what happens in the Latino communities. Okay, the right now the Latin League of American Citizens. What about all of these people who are undocumented? What do we say about them? I was just heavily involved in the case with a 9-year-old boy who had to testify the first time in U.S. history before a judge as to why he didn't want to go back to Honduras. And I sat there and I watched that boy be picked on. How did he know these things? Did his mother coach him? This doesn't just stop. Yes, it's hitting the African American community badly. I'm not downplaying that at all, but we have a responsibility to humanity here. And people are living with rats and roaches. Babies are hungry. People, they have to go to work.
That point that you made, Sister Donna, that we have a responsibility. I feel like that right there is like the money quote, that we have a responsibility individually, each and every one of us, to play our role in fixing the problems that we're seeing in our society. Brother Edward, we had one final question that I think was it you who wanted to ask?
No, so I think this comes from our producers, you could say, and we've been asking this to a few different guests, Donna, so forgive us if this is putting you on the spot, but the question is, if you had access to a billboard, right, a billboard that would be seen by the public, people could be impacted by the virus, are impacted by the virus, politicians, whoever, you could put up a billboard in Chicago, what would you put on that billboard? What do the people need to know?
Simple. I would put save a life, okay? You wanna adopt a highway? Now I'm getting upset. You wanna adopt a highway? Seriously? You wanna plant a tree? Save a life. Save a life. Don't charge me $20 for an N95. Don't charge me $10 for a bottle of hand sanitizer that cost $1.50. Okay, 2 months ago. You know,
I know,
go
that's
out
right.
and give somebody a mask. Go out and give somebody a mask. Go into your pocket and buy some masks. You know, drive in your car, crack your window like this. Crack your window just like this. Give somebody a mask. Give somebody a mask. My husband and myself, we were out just giving people masks and giving people gloves. You know, yeah, me and him both could die. And what'll happen to me? It doesn't matter. Doesn't matter. You know, it matters to the people that love me. Yeah. To Zakat Foundation. But you know what? Somebody's going to die. I won't have my hands bloody in it. Save a life. That's what needs to go on that billboard, brother. Open your eyes, save a life, you know, save a life. And chances are, if you see someone who's darker than you, they probably need a lot of help. And I'm sorry to say it that way.
Well,
You know,
sometimes we have to put it plain. Sometimes it's got to be said the way it is.
people need to know, you know, and when you come to America, you have to know this is an issue. This has always been an issue. It happened to the Indians first, and it's happened one by one. Racial stereotyping. It's happening to Muslims. It's happening to everyone. Every single group of people it has happened to, but have been able to shake off racial stereotypes, with the exception of the African American. And if you don't think that that's true, there's a very important book called A Condemnation of Blackness. Read it. How every other ethnic group has been able to shake off the stereotypes of being all kinds of things, of being thieves, of being involved in the mafia, of working, you know, all those horrible stereotypes of running laundromats, of this and this and this and that. But African Americans have never been able to shake off that stereotype.
You know, Sister Donna, to that point, I was born and raised in Baltimore on a personal note. And I remember I was having a conversation a few years ago with a mosque leader at the Islamic Society of Baltimore, one of the largest mosques in Maryland. And he made a point. He said in the 70s and 80s, when there was a huge influx of immigrants coming into the state, coming into the city, into Baltimore, vast majority of them barely knew how to speak English. And it was the Black Muslim brothers and sisters in Baltimore who held their hands, who taught them English, who taught them how to integrate into society. And we have a responsibility to learn from those experiences and to uplift those experiences. So Jazakallah khair so much to you for sharing, for bringing the facts and for keeping it real, keeping it raw. And I know I personally benefited so much from having you here tonight. Alhamdulillah. Jazakallah khair for being here.
So please donate. Please go to Launch Good. Help us to do what we do best. We're 20 years old. We've been in over 40 countries for the last 10 years. That is just an amazing growth in 10 years. To start from scratch, I don't want to say we were a garage band, but to start from scratch and within 10 years being in over 40 countries, we must be doing something right. And we help whoever is in need. We feed whoever is in need, you know, so that's my
website for us one more time. There we go. Good. Excellent. Our producers are reading my mind, mashallah. The website once again is
that's
the Launch Good. Okay. Nice.
Yeah, you can go to Launch Good, or you can go to info@Zakat, or you can go to zakat.org. Okay, we are Zakat Foundation of America. We do not own the name Zakat, but we are Zakat Foundation of America. And please just help us. We will be there. We have always been there through Flint, through Hurricane Katrina, we're through Africa, through Asia, 40 plus countries strong, including the US.
May Allah reward you all for the work, and may Allah allow us to donate and to share in the blessings that you all are getting. Donna, thank you so much for joining us this evening. Thank you for your wisdom, your information, your commentary, and I think most of all, your advice. And I hope it is of benefit to everyone who listened tonight. So thank you so much, and please keep in touch with us and let us know if there's anything else we can do to help you or Zakat Foundation going forward.
Thank you so much.
Assalamu alaikum, Donna. And a big thank you to my co-host Zainab, who I think did a wonderful job as usual. We look forward to seeing you do this many more times, inshallah. Zainab, do you want to close us out, or do you want me to do it? Totally.
I'll let you take it from here. Jazakumullah khair, Brother Edward. It was a pleasure to co-host with you.
Thank you, Zainab, and thank you to everyone for watching the Daily Dose COVID Conversations with Care. As you know, the program airs Monday through Friday at 8:00 p.m. Eastern Daylight Time. If you have a topic you want us to address, please reach out to us. Please post it in the Facebook comments. And inshallah, we can look into bringing on guests to address that topic. If you have a guest you want us to bring on, if you yourself have an expertise you want to share, feel free to reach out to us as well. We want to cover topics that are relevant and important to you, the viewer, the Muslim community, and all communities across the country impacted by COVID-19. Inshallah, we will see you all tomorrow night at 8:00 for the next episode of the Daily Dose, COVID Conversations with Care. We close as always. Subhanakallahumma wa bihamdika. Ashhadu an la ilaha illa anta wa astaghfirullah wa atubu ilayh. Assalamu alaikum, everyone.
Assalamu alaikum.